So thank you for having me here. I want to give you an update on our company, Idogen, which is in a very exciting phase. We are moving from preclinical into clinical phase. I just want to give a brief update on the status on where we are as a company. First, just the disclaimer, and then we move into the content for the meeting. I want to give a short introduction to Idogen, introduction to cell therapy, and the specific unwanted immune response that we are targeting as a treatment. Introduction to our technology and platform, company platform, our cell therapy market, and also key activities moving forward. Short introduction to Idogen, a biotech company based in Lund, Sweden, founded in 2008, listed on Nasdaq First North. And what is quite specific here is that we have a very young IP protection. We have the opportunity to have market exclusivity until 2040, 20 years from now. We're developing tolerogenic cell therapy, and we also have an external validation. We received the European funding, Horizon 2020, 30 million Swedish kronor to support the development of IDO8. The indication, the first one is orphan drug designation, and we are starting the first clinical trial in the second quarter in 2022, and we apply for the clinical trial application now in end this year. So what we offer is a treatment with considerable possibility to treat considerable unmet medical need. We are developing tolerogenic cell therapy aiming to prevent unwanted immune responses. And we have a proprietary platform technology which protects the platform, the indication, but also the process for manufacturing this technology. And we have two triggers ahead of us. It is starting the clinical trial for hemophilia, the first indication, Q2 next year, and also the big indication, which is transplantation, asking for clinical trial application in end 2023. Cell therapy aims to use cells to repair cells within the body. You can use patient cells or donor cells, but the key thing is you treat them outside the body, but inject them into the patient, and with the aim to cure a condition or a disease. Short introduction to the company Tolerogenic Cell Therapy. We are using the dendritic cells, which plays a significant role in the immune system. The dendritic cells has the ability to sort out friends and foes. And what you see on the left-hand side, the red side, you should identify virus, bacteria, and cancer cells, and start and activate an immune response. On the other side, you have the tolerogenic side, which we are acting on. We are acting on a situation where actually the immune system is attacking the body's own tissues and cells, transplantations, food, and other things. And that is what with our technology aim to instead tolerate. Very specifically, instead of giving a treatment with immunosuppressants, which covers the whole immune system, we want to very specific instead target the specific antigen that initiate this response. We're using the patient's own cells, so we are harvesting the cells at the local hospital. We are then sending them to our GMP manufacturing site. We are introducing the cells to the disease-specific antigen, and then we add our tolerance inducer, our proprietary PET or part of this technology, and we develop the tolerogenic dendritic cells, which actually is the specific cell therapy that we are then sending back to the patient hospitals. and we are giving the treatment 1 to 3 injections within every second week. As a company, we've made a very important decision in 2019 when we decided to partner with Radboud University Medical Center in the Netherlands. They are global leaders in manufacturing of cell therapy based on dendritic cells. They have been treating patients since 1997, and then more specifically in cancer patients, so they're using the red side of the immune system. And what was new for them was to apply their technology together with our technology into the green side. So this is what we have done the last year, and now we are ready, and we have a GMP approved treatment for patients that we will now send in a trial application end this year, but also to start clinical trial in early 2022. So the specific conditions that we are targeting is anti-drug antibodies, where the immune system attacks biological treatments. The next indication is transplant rejections. Patients that is normally treated lifelong with immunosuppressants, we are trying to switch us off these unwanted immune reactions on these patients, and also the big group of autoimmune diseases when the immune system attacks the patient's own cells, attacks own cells. So this is the commonest that we want to switch off this specific unwanted immune reaction. So we have identified 3 specific projects: IDO8, IDO-T, IDO-AID. First is IDO-AID, hemophilia patients. A genetic deficiency lacking factor VIII. Normal treatments is substitution treatment with factor VIII, and patient that is, so to say, developing antibodies towards this treatment. This is what you see on these slides. And what you want to do here is to switch off this unwanted reaction and instead continue with the treatment of factor VIII after the treatment. In transplantation, we take first the status where we are in the development project. We are in the middle bar, where we are close to stepping into clinical trial, which will happen in the early 2022. And we expect to have final data in the end of 2023. For transplantation, we have a big group of patients, around 100,000 every year, getting a new kidney. And the large medical need is here that the immunosuppressants also had a negative effect on the patient. You increase the risk for severe infections, for cancer, but also direct nephrotoxicity on the patient's kidney. And what you do here is that you take the patient cells, you load with cells from the donor, and you add the proprietary tolerance inducer in order to treat before, at time for transplantation, or after transplantation to create tolerance for the received organ from the patient. So we aim to switch off that immune reactions. Status here, we have the knowledge of the platform. We are now developing the specific treatment for the transplantation patient. We are adapting to the platform. We will in next year do the pilot proof of concept, the year after the main proof of concept, and prepare to send in clinical trial application within the end of 2023. So this is the 2 main projects, and briefly about our market. We are looking into market with cell therapy where they are able to use this kind of technology. If we look at the markets in North America, Europe, and Japan, you have around 50,000 patients with Hemophilia A. Around 1/3 of those is developing antibodies, and around 1/3 of these not able to be treated with an increasing dose of factor VIII. So this is a target market for our first indication. It's an orphan drug designation, so it's rare. If you go for the next one, transplantation, we have a lot bigger group of patients here. We have around 40,000 patients per year transplanted with a new kidney, and around 11,000 of them is receiving a family or a related donor or organ from a donor, from a related donor. And the benefit with that is that you can prepare the transplantation at the time that fits the donor as well as the recipient. So, key activities for the next years. We are now finalizing the application for clinical trial for IDO8. We are preparing IDO-T for the platform. Next year, we start the clinical trial for IDO8, and we are then making the pilot proof of concept for IDO-T, the clinical trial for IDO8 in 2023, and IDO-T is then the main proof of concept, and then stepping into clinical trial. So this is how it looks like for the next 2 to 3 years. We have two very interesting projects. We are moving into patient within half a year, and we have a treatment that is meeting considerable unmet medical needs that we will offer the market. I think that was what I wanted to present today. Yeah.
Thank you, Anders. Please let me know if there's any questions, then you can do it on the right-hand side. But Anders, first of all, being a listed company and your involvement in this as a person, do you own shares in the company, and how much?
Yes, I have shares in the company. I have bought up more or less any opportunity since I entered the companies. So I have 175,000 shares for the time being.
And who's the main shareholders, if I may ask?
There is a large amount of shareholders, a quite big retail group of shareholders, but it's also others that is, let's say, on the list here, around 3% each, so relatively small shareholders in the company.
Okay, so many small shareholders it's more like that. So you are depending on the market, so to speak.
Yeah, we are. Yeah.
And so the near future, I think it's pretty obvious that there will be a lot of news coming from more on the clinical side. And I also think you gave us some numbers, but sort of your aspirations as to what can this be in terms of revenue and growth and stuff like that. And when will you see the first revenue? When will you do these kind of things in your opinion?
Our so to say, plan to commercialization of the company is to develop IDO8 and IDO-T, but we are also looking for partners moving forward. So I would say that the critical things for the company is to show in the phase 1, phase 2 that we are now launching for IDO8, as can also be perceived as a proof of concept in human, will be very critical both for that indication, but also for the platform as such. So I would say that the next step is moving to patient, but also to show that you have a proof of concept in human.
Yeah. And at that stage, your whole concept will be validated. Is that fair to say?
I should say that there is the first proof of concept, and we, if it works, we have a clear answer that yes, the concept works. So yes, that will be a very important timing for the company when we are releasing the data from the IDO8 study.
Yeah, but it will take some time, of course. But perhaps looking at your presentation, hearing your presentation, you're talking a lot about the platform. And I guess that there's also a lot of work to be done when you use cell therapy. So you have the communication with the hospitals and the patients and stuff like that. Can you tell us a bit about how that's organized, and perhaps more importantly, how that differentiates you from your competition?
I mean, as a small company, you usually work with the partners. I mean, the manufacturing. I mean, they have processes for that, and they towards us acts as a professional manufacturing site. but they have also been part of development in creating from our innovation of the technology from the development bench into making a clinical treatment for a patient. I mean, that is quite a lot of work that has been a collaboration between us and Radboud, for sure.
Yeah.
And I mean, another thing which is important to also understand at this stage, I mean, the development has progressed quite far when you have the opportunity to start to do clinical work in patients already in phase 1, which is significant compared to the traditional pharmaceutical development.
Yeah. And with the partnering, just to understand that, at what stage is that relevant? Because you're so early stage now. When would you expect a partner to be interested?
I would say that when you have, so say, a proof of concept in human, I think that is, so to say, a stage where you can move from a development company early stage into a company where you also can add a lot of value into the company, but you also need to invest at the time. So I think that the difficult thing is in an early stage of development, you're usually investing quite a lot, but you are not really able to show in terms of data where you are. But when you move into clinical and you also have proof in human, then you move into a total different, so to say, valuation criteria when you look into that. Because a lot of risks is then taken away when you move from lab bench into patients, and you can also measure, so to say, the first data out of the patient.
Anders, thank you very much for joining. It was a pleasure to hear your presentation. We look forward to following your company long term. And thank you very much for today.
Thank you. Thank you for being invited to this meeting. Thank you.
Our pleasure.